The TFL है ना, corroding ulcers of the cancerous nature on cheek. हाँ, sores healing very slowly, passing into gangrenous, malignant ulcer in different parts. है ना, this is corrosive ulcers on a auricle scab. This is the line. And we have to read the part. After reading only we can know what is the line it is given. If we do one word or two word, then we will get the medicines, but we have to read the paragraph with what are the lines in that location they have given. Okay. There is also the old case of a urinary bladder. In the base of the bladder, he was having large polypodal growth since 2016, and it was bleeding like a black color. Bleeding was having. He was having. The patient's name is Daud Patan, 72 years male from Thala Indapur. 6th July 2018 he came. His presenting symptom was dark color urine, dark, very brownish dark color urine color. He brought me, I will show the photo also. The urine was very dark color, blackish color was there, and large clots were there in the urine. Large clots, very large clots it come. The urine frequent and dark red since 1 month. Addiction for tobacco and smoking also. And there was history of urinary bladder thickening since 2016 in sonography. Later, he developed polypodal growth in the base of the bladder near the prostate gland, and the whole symptom started. In spite of all this, also he was intermittent taking allopathic treatment, taking so and so many. Then also he was getting better way. Again for 1 month better, 1 month not feeling better, and same state of symptom also there. Black color urine, and same state was recurring again and again. Origin, duration and progress. He was suffering from 2016. Initially the urine was very red color, and pain was, then burning was, cystitic like symptom he was suffering. Scanty sometimes or more profuse. In 7-8 months he started with a dark blackish urine, coffee color like urination. He was initially on allopathic treatment. After taking homeopathic treatment from 2016 in Mahad, there was an old homeopathic doctor, very old. He was taking the powder in powder form. They were giving the one stat dose. He was told after taking dose, I was feeling better. Again the symptom starts in next month. Like that he was taking the medicines from 2016 till he came to me 2021. Then only temporarily the symptoms was going with the medicine. The bleeding was coming proper way, urine was passing proper way. Again after the dose has vanished, the same symptoms reoccur again. So I advise him to do cystoscopy and do CT scan or any other imaging scan, which you can see what is the pathology inside. They told us that there is a papillary tumor growth with malignant ulceration in the base of right base of the urinary bladder, and they have to remove the part, or they have to take chemotherapy, radiotherapy, like that. But I ask also for them, do not do biopsy. When they will do the cystoscopy, they punch out the part and they give the testing. I told him, I written in bold, do not do the biopsy, only show me whatever is there, I will see the further. So they do not did the biopsy and they came back. This is the urine of the patients. After rotating the bottle outside, this is the large clots coming in the urine. This is the same urine he was urinating. Thick, and even the utensils of the toilet source was staining with the color, with such a dark color was there. such a heavy bleeding was there, even dark bleeding, and all papillary ulcers were opening because of that, and because of smoking. Because of smoking, initially I thought because of prostate CA it can also happen. The nearby causes there, smoking causes there, or tobacco history is there. But I did the prostate serum antigen also to confirm whether it is because of prostate or purely of bladder cancer. But it showed me bladder cancer when I did the cystoscopy. So I confirmed before that also. Before doing cystoscopy, I did blood investigation. Then finally I suggested the this one cystoscopy. Analysis of growth was urinary bladder growth was there. Urine brown, dark red, coffee color. Urine was scanty with whole day in same pattern, and frequent hematuria with large deposits of clots in blood and urine. This is the main symptom. Huh? I have written in thoda dark area. Huh. These are the probable medicine which were coming by attacking, putting the urine dark color clots. Arnica was coming, Pulsidilla, Camphora, Apis, Merck, Cantharis, arsenic and Lyco. These are the common medicine which acts on bladder and which use dark color or black color bleeding. The medicine selected was Pulsidilla on those symptoms. The Pulsidilla is having those symptoms. A dose for 10 strokes, 40 drops in 100 ml water, and 2 teaspoons 4 times a day. 4 times a day. I suggested, I said him give the follow after few days. This is the sonography, UG sonography, where they have mentioned below part. And there is a CT scan. CT scan also mentioned. Urinary bladder, undefined, substantial trabeculation and posterior wall of the bladder, urinary bladder, and mildly widened. This is the previous 2017 reports which he has done. This is also 2016. He is already suffering with grade 1 fatty liver. See, history is there of fatty liver. For any cancer, liver cirrhosis, fatty liver is always present. After fatty liver only you can see the cases of the cancers. Otherwise, you cannot see the cancer cases. These are the bullet report previously which he had done before coming to me. PSA was normal, 0.57, nothing was there. So only the renal functions and liver function were hampered because of smoking and not normal diet. This is urine. This is the previous paper where he examined. Here is the lesion, lower part of the base, right lateral. Urine, occult blood, poor occult blood, proteins were there. This is the previous paper when 2016 he was taking the treatment. He is a surgeon, famous surgeon. After 15 days of the medication, the urine bleeding was reduced than before color. Only during the morning the dark urine comes, then whole day the normal urine used to come, and urine was not spilling offensive, but dark red and mild clots were there. In the when he urinated, the dark red and mild clots in minute quantity he was passing. I continue the medicine, next medicine 0/2 Pulsidilla, same dose, 10 strokes, 40 drops in 100 ml water, and same doses 4 times a day. After Pulsidilla, the urine slight color change. The dark color was there, it became faint red, but color was still red. Still those, the main picture of the disease was not gone. This urine came after 15 days. The clots were in the minor quantity, not very large that time, but sometimes in the morning they have passes large clots. After 9 days of second follow-up, urine was getting better whole day, but still mild bleeding was there. Minute, not occult blood, but fresh blood bleeding was there. The urine color was now red, but bleeding with clots were present, mild blood. No other symptoms. His son told he was smoking. I had stopped him smoking, but while going to toilet in the bathroom, he smoked. Because of that, the symptom remained. So I searched the medicines. I gave him the lycopodium. In lycopodium, the symptom is there. dark red, large clots. The medicine is there. In lycopodium, so I started him antiseptic medicine. 10 strokes, 40 drops in 100 ml water and 2 teaspoons 4 times a day. Same dose, like that. After that, again the urine color get decreased more and more as compared before. This is the morning urine. I collected in morning, not in between urine. How is the first urine I collected? That also was morning urine. After day, he used to urinate normal color, but in the morning, this color was there in early morning samples. Okay. On third follow-up, after giving the medicine from the next day, he never passes. After starting lycopodium, from next day, the color of the urine and bleeding immediately stops. Urine was very clear, mildly yellowish over there, and I advised him to take more water. And smoking was stopped 9 days before completely, before 9 days, and till that he was smoking only. See how the patients are. This is the normal color in the morning sample. After fourth follow-up, 20 days after, no urine bleeding was came. Urine was clear completely. No complaint. I already advised him stop smoking and continue the dose. I increased the dose of LM Lyco 0/2, 50 drops, which was initially 40 drops, and 3 times a day, which was before 4 times a day, as urine has been clear. After 30 days also, no urine clots passes. Medicine has finished. I started with 0/3 potency, same medicine, has medicine acting very well. Same dose, 10 strokes, 50 drops, 3 times a day. Continue the medicines. Okay. After this is also fourth month, I think, fourth or fifth month, no complaint started. Last 2 months happens. He developed the skin eruptions. He has not told me that he was suffering from skin eruptions on waist, on all area, those area. He applied some allopathic cream that time, but I told him I was in contact with the son. He told me that his father has something as eruption has started on hips and waist area. He applied some antifungal cream. So I was worried, or his previous symptom can aggravate, or bleeding also can come. But he told me this was the previous sign initially he was suffering with. Initially, when he suppressed, because of that it came again. Then I changed the medicine sulfur. After sulfur, then 15 days it goes on its own. Then I gave the dose sulfur, 10 strokes, 50 drops in 100 ml water, and 2 teaspoon BD. And I asked follow up after 10 days. He came only after finishing the medicine sulfur. I asked him to give the follow up after 10 days. No bleeding has started. Improvement started in last 3 days, 3 months, which was in last 16. Skin eruptions also recovered in 10 days. I advised to patient to do